Anaphylaxis is a severe, life-threatening, generalized or systemic hypersensitivity reaction. It is characterized by rapidly developing life-threatening airway, pharyngeal or laryngeal edema, and/or breathing, bronchospasm and tachypnea, and/or circulation, hypertension and tachycardia. Problems usually associated with skin and mucosal changes. Anaphylaxis tends to happen suddenly and quickly. There often isn't a warning period, but there can be mild signs like hives or flushed skin. Some healthcare providers break the stages of anaphylaxis into 4 categories. Stage 1. Mild anaphylaxis is the first stage and can cause symptoms like skin rash or redness, itching or hives. Stage 2. Moderate anaphylaxis happens when a person has more widespread and extensive symptoms like skin rash and hives that are spreading or mild swelling in their lips or tongue. Stage 3. Severe anaphylaxis happens next and involves a person displaying signs of difficulty breathing, extensive swelling, weak pulse or dizziness. A person in stage 3 anaphylaxis is experiencing a condition called anaphylactic shock. Stage 4. Life-threatening anaphylaxis is the last stage and involves a person losing consciousness, being unable to breathe and having inadequate blood flow to vital organs. A person in this stage needs immediate medical attention to avoid death. What are the symptoms of anaphylaxis? Anaphylaxis usually begins with skin symptoms of hives or itching. Within a few minutes, you may start experiencing more severe symptoms, including swelling in your throat, lips and tongue, shortness of breath, wheezing, hives, red rash, difficulty swallowing, abdominal, belly, pain, chest tightness, cramps, diarrhea, feeling of doom or dread, vomiting. What are severe signs of anaphylaxis? Lightheadedness or confusion due to a drop in blood pressure, increased heart rate, sudden weakness, unconsciousness, cardiac arrest. Anaphylaxis is likely when all 3 of the following criteria are met. Acute onset of illness with a sudden progression. Skin or mucosal changes. Life-threatening ABC problems. Urticaria, angioedema. Life-threatening airway and/or breathing and/or circulation problems. Skin or mucosal changes alone are not a sign of an anaphylactic reaction. Skin or mucosal changes can be subtle or absent in up to 20% of reactions. For example, some patients can have only a decrease in blood pressure, i.e. a circulation problem. Anaphylaxis requires acute onset of illness with a sudden progression, skin or mucosal changes, life-threatening ABC problems. Adrenaline. Adrenaline is the most important drug in the treatment of anaphylaxis, and there is no absolute contraindication for its administration in treating this condition. Emergency treatment overview. Initial steps. Call for help. Lie the patient flat and raise the patient's legs. Establish an airway if necessary and apply high-flow oxygen. Apply appropriate monitoring, blood pressure, pulse oximetry, ECG. Remove the trigger if possible. Adrenaline. Give immediately or as soon as it becomes available. See next slide for further details. Fluid challenge. Give a crystalloid fluid bolus. Adults, 500 to 1000 milliliters intravenously. Children, 20 milliliters per kilogram intravenously. Adrenaline IM dose use 1 milligram per ml. 1000 adrenaline. Adult and child * 12 years. 500 micrograms IM, 0.5 ml of 1 milligram per milliliter adrenaline. 6 to 12 years, 300 micrograms IM, 0.3 ml. 6 months, 6 years, 150 micrograms IM, 0.15 ml. 6 months, 100 to 150 micrograms IM, 0.1 to 0.15 ml. Give 300 micrograms IM, 0.3 ml. In a child who is small or prepubertal.